All right. Once again, I would like to welcome you to one of our National Faculty Meeting breakout sessions, How My Cancer Diagnosis Made My Course Room More Inclusive. On the line today, we have Dr. Heather Alonge and I just said that a second ago and I messed it up. Dr. Heather, who is a core faculty member in the MHA program with the College of Management and Human Potential. It's my pleasure to be hosting for you today, and welcome, Heather. So great to see you.
Thank you, Lita, and thank you to everyone who made the time to attend today. It means a lot to me to be able to share this experience with all of you. I will say that if you came here today in hopes of gleaning some best practices from the literature, some hardcore statistics and facts, unfortunately, I am going to disappoint you. If you're here today to have a discussion to learn more about my journey and how something so personal was able to create an impact in how I teach and to create a course room that is more inclusive, this is the place for you. I today would like our time together to be a discussion, if you will. I would love to engage. If you want to chime in, you have any questions, again, as Lita said, you can type it in the chat, raise your hand, come off of mute, and we can go from there. Please know that, no question is too personal. I know sometimes when we talk about things like a medical diagnosis or cancer, people oftentimes are afraid of a boundary or hitting on something that is personal. And for me, I am very open and very transparent in my journey and my experience. And it's my hope that we together can leave this session at the end of the hour, having learned more from one another and being able to take away some points that will benefit the work that we do within our community of scholars here at Walden. So Lita, if we can go to the next slide. So this here is a word bubble, and I wanted to share with everyone what I believed were my perceived faculty attributes. I have been teaching in higher education since I received my master's degree. So I've been doing this for 15 years. I've taught across all the degrees, associates all the way up to doctoral. I've been with Walden for a little over 3 years. I thought I had it nailed down, my faculty attributes. And as you can see, I was a professor first, a person second. I felt I was innovative, I was policy-minded, detail-oriented, empathetic. I really wanted to bring a real-life focus to leadership, to be diligent, and I still feel that I hold many of these attributes. And if you'll see, these are prior to August 24th of 2022. So the next slide is my self-perceived faculty attributes after August 24th, 2022. As you can see, some things swapped. I became person first, professor second. I became student connected, a cancer warrior. I wanted to share my experiences and I wanted to be empathetic. So what happened on August 24th, 2022 that made me have this flip in my attributes as a faculty member to our students? Why did I go from professor first, person second to person first, professor second? I was diagnosed with cancer. So on August 24th, I received the news from my surgeon that a routine surgery, I went in for a routine hysterectomy, was not so routine, that the pathology report came back that I had an exceptionally rare form of cancer. I had a uterine sarcoma. And to say that it was a shock is an understatement. My whole world changed in that moment of receiving that news. And as we went through the first week of that diagnosis, and for anyone who has received a diagnosis or has had a loved one receive a diagnosis, you know how time stands still. That week of waiting between getting the diagnosis and when I could get in with the oncologist, and then that time from seeing the oncologist to getting the scans and the labs and understanding what this all meant was agonizing. It was as if the whole world came to a halt and that I was just standing still in time trying to get answers. So I began to move forward in the process. I come off medical leave. I come back to work and I enter into the fall term. And I had made it a thought in my head that I was not going to allow this diagnosis to find an intersection with my professional world. What was going on at home, what was going on personally was exactly that, personal. And that I would still be professional. I was still going to teach my courses. I was not going to change how I taught, when I taught, why I taught, that it was what it was. But I learned very quickly that that wasn't the case. As we know, having lived through the last 3 years with COVID, our students have experienced extraordinary challenges within their personal lives, within their health. And as students began to reach out to me, as they began to share their challenges, I realized I had a great connection to these students going through my own cancer journey. And so I realized that that was opening a door, that by becoming more empathetic with them, allowing them to know that I too am a person outside of this course room, that I too was going through a challenge, that not only was I, here working as a faculty member, but I was at home. I was raising 3 small children. I have a husband who has his own challenging, demanding career. And then, everything else that happens with your social life, your extracurricular commitments. And then I had this cancer diagnosis that I felt the challenges. I could firsthand understand what they were going through. And by having my own experience, I was able to have more empathy and to allow our students to know, I see you, I feel you, and I'm here to help you through this. And by doing that, I felt like I was able to wipe away some of the rigidness I perhaps had prior to this diagnosis. If we can go to the next slide. So, how did I take this diagnosis and create inclusivity in the course room? It's still a process for me, building the inclusivity. Still a process with navigating the cancer diagnosis and what will happen. But the first thing I did was I saw this diagnosis as an opportunity to build the better relationships with my students. As I said, sharing with them my own journey. I connected with them on a more personal level. Sometimes I realized that all they want is someone to hear them. And by saying, I'm listening, tell me how I can support you, is the greatest gift that they may receive through their challenging times. This diagnosis also allowed me to reestablish my purpose as a faculty member, a mentor, and a researcher. I was able to attend the American College of Healthcare Executives meeting in March. And it was so amazing to be there with a different lens on. I've been to these annual meetings for many years, but to come in from the lens of not only a professional, but as a patient was empowering. It's helped me change my research focus to understand the need for research around social determinants of health and for access to women's health and health literacy. I've been able to build stronger connections with my leaders, with my colleagues on our team, And I realized that I'm not going through this alone, that I have a whole tribe right next to me in my professional world that will help me overcome some of my challenges and hurdles. It has also allowed me to build meaningful connections with my students and for them to build connections with one another. One of the things that I have done is I share video vignettes throughout the course. So for those of you who don't come from the College of Health Management or Management and Human Potential, I am in healthcare administration. So I teach healthcare administration courses. I mentor DHA students. So to have that gift, if you will, of teaching healthcare related courses and then to navigate the healthcare system personally has been rewarding. I record videos here throughout the term. Sometimes I record them when I'm at my appointments or after an appointment or when I have an encounter, and I share with them situations like navigating the billing system, quality improvement, the importance for accuracy and medical records, easy access to medical records, things as simple as when a facility is designed, the thought of the parking lot or parking structures is incredibly important for patients as they go to their appointments. So I share these little videos and the students really connect to those videos, and they'll reach out to me and they'll explain to me a situation that they have had, or sometimes they give me wonderful advice on how to get an answer, some resolution to a challenge that I may be having. Or they will, say, I never thought of that. As I'm starting to think about my capstone research or this project, you gave me an idea. So, taking these small encounters that I have through the oncology system and through the patient perspective has allowed them to connect with me and in return connect to their curriculum, to their research, to their capstone topics. It's also given me an opportunity to respect my students' journeys, challenges, and abilities. All of us have been through degree programs. We understand the time commitment. We understand the sacrifice. But I think that sometimes we become removed from that the longer that we've been doing this and, the further away from our graduation dates. So to be going through something so personal and then to understand, well, gee, I'm navigating this while working full time is definitely eye-opening. And then I think about how fortunate I am to have a strong support system through my family, through my friends, through my colleagues, through my neighborhood, and that oftentimes many of our students don't have that support system. So they're going to school, working full time, caring for family members, small children, and they may have challenges as well, whether it be mental health challenges, physical diagnoses, overwhelmment, fatigue, and that they don't have a support system in place. So going through the last several months has given me an opportunity to step back, to understand that rigidity is not always necessary. That if I can provide a bandwidth and a support system and an infrastructure for my students to navigate their journey, to navigate their challenges, to recognize their own abilities while staying within the policies of our program and university, then I'm becoming a better instructor. I'm creating a community of care. I'm providing an inclusive learning space for our students. And that, they don't sometimes have anyone. And if the small interactions that they have with me throughout the week gives them that support system, then that's something well worth it. And because of all of this, I've been able to build that community of care. And that's one of the things that I really want our students to walk away with when they're, walking across the stage, earning their degrees, going off to leave their legacy, is that someone cared about them, that they're not just a name on a screen. And the reason I say that is that in one of my experiences as a patient, my very first oncologist that I saw, I felt like I was no more than just a name on a piece of paper. The oncologist saw my name on a chart and that was it. There was no connecting to me. There was no true care. I was literally just a clinical protocol that came from a journal about evidence-based practice in sarcoma care. And I realized that I didn't want to be treated like that. So how could I treat our students like that? I want them to know that they are more than a name on a roster. They're more than a grade on a final grade book, that they are here as people who have the opportunity to leave an impact, to grow and to contribute. And if nobody else tells them it, it is my great pleasure to tell them during their time here that they matter and that they are going to make a difference in the work that they do. We could go to the next slide. So I talk about purpose. We all go through life hoping to have a sense of purpose. And as we experience life, we experience situations, possible setbacks and challenges, we oftentimes either question our purpose or want to redefine our purpose. And I thought about my purpose as a faculty member here at Walden. I thought about the purpose of the leaders that I have the privilege of learning from and following. I thought about my colleagues and their purpose, our staff members, our students. What is everyone's purpose? And how do we take our individual purposes and bring it together to create a community of care? So purpose, based upon the research that I did, purpose is about applying your values, your passions, and abilities for the greater good. So I want to take a moment here and just pause and see, does anyone have an idea of what they would say their purpose is? What is something you're doing that is helping to apply your values, your passions, or improve the greater good? And feel free to come off mute, type it in the chat. I'm just curious to see what we feel our purpose is as a individual and a contributing member. I know some of you on this, you're not shy.
And if you'd like to raise your hand, I will unmute you because Zoom webinar automatically mutes everybody. So please feel free to raise your hand or type in the chat.
Miriam.
Hi, Heather. First, I want to say thank you so much for sharing. It really brings so much to how we view our personal life, because it's so easy to get lost in our professional life. So easy. And we all will have different challenges. I think having the diagnosis you had is one of the greatest challenges and something we all think about all our lives. So I commend you for sharing and for providing such a wonderful example about being positive in the face of adversity. And so I do think, you brought to mind, and I attended the meeting yesterday, and just hearing everyone's sharing of their purpose in regards to Walden students and our personal lives just says to me how we do need to connect them and how important the connection is. So I guess I would see my purpose as really sharing myself with my students, which I do try to do, but I see the importance of the values and our passions and our connecting and caring about students as well as ourselves. Very important, especially in light of some of the things you have mentioned. So thank you.
Thank you, Miriam. I see Cheryl has a hand raised as well.
Hi, Heather, am I unmuted?
You are.
Hello there. Thank you so much for sharing so lovingly and openly and vulnerably. I am heartwarmed. I'm already experiencing transformation from what you shared. My heart, you have my heart as you already know. And your strength is just absolutely unbelievable. We are really blessed to be in your tribe. Thank you. Thank you for, representing love and caring for our students, caring for your family, caring for your colleagues. You just exemplify so much of what it means to be a social change agent, but to be a most beautiful human being. And I'm really coming from my heart with what I'm sharing, Heather, because within the first 5 minutes when you were talking, I call it conviction. You might call it something different, but I'm just already, just thinking about me and how I can make a difference. And not just for me, for other people, for our students at Walden, that it would be reflected in the work that I do. And you mentioned the rigidity, and that really struck a chord with me. I see myself as gentle often, but that rigidity for me really struck a point. So that's just saying I am so open to, that improved humility and empathy and compassion. And it's a journey. I thank you for sharing your journey. And I just pray for you and your family and to continue to be a part of that journey and to learn all I can and to bring it forward. I have a saying, bring all of who you are into all of what you do, and hearing you encourages me to do just that more and more and more. Just thank you, Heather. We are really blessed. We're very fortunate to have you and that you're sharing of your journey, your experiences as you are. And as far as my purpose, it's encouragement and love. And so that comes through, I pray that comes through everything that I do. And I know it's a work in progress, but I'm also somebody who is ever the introvert until I'm not. But, not liking to discomfort with being on the forefront, the front line, especially if I mess up, if I make a mistake. And what I'm just hearing and seeing from you is just a wonderful example of, we're all human. Nobody's perfect. This is where we're connecting. We need each other. We're not meant to do life alone. And it just makes I feel braver now. It's okay, really just be you, but do so with greater good in mind. And with that, I just love you. And I thank you for you.
Well, thank you, Cheryl. I said I wasn't going to cry. I'm trying to hold it back.
Okay, please don't.
But I appreciate that. I see here a couple of other people typed in their purpose. Sarah said to help others build their career journey through mentorship. Bria said helping others get to their greatest level. John said his purpose is to develop competent, purposeful, and ethical healthcare leaders of the future. And Gloria said her purpose as an educator is to teach, train, and develop students. And for many of you, I know so many of you here today personally, I can tell you that you are definitely living your purpose. And, I am so honored to be able to witness your purpose and see the change that you're making as both professionals and just truly gifted individuals. So questions about your life's purpose may arise at any time, but you may notice that they're especially prevalent during times of transition or crisis. And so for me, you know, for those of you who have known me for a while, I am very type A, and I like to get things done. I feel for my 3 small daughters sometimes having to grow up with a mother like I am. But it is definitely an attribute of mine. I always felt like my purpose was to be a strategist, to get things done. You know, I like structure, I like organization, you know, to move people and processes along. And in fact, I came over to the MHA team from the DHA side for that very purpose, to work with Sarah and Cheryl and Lloyd and Carlin on the CAMI accreditation, because that's kind of who I am. I see a process, I get it done, I tackle it, I bring the research, I bring the evidence. But when I got this diagnosis, I began to question a lot of things, as anyone who has experienced either a health diagnosis or has had a loved one or a close family member encounter. You start to question the whole why of this. Why am I going through this? What is this serving to teach? What is the purpose? And for me, what I was able to glean away from it is that cancer was an opportunity for me to reaffirm my purpose, which is to serve as an educator and a researcher in health services. And I find it so, I don't know, coincidental that I chose a discipline, I chose a career path within health services, that I spent 20 years of my career in maternal and child health, working at a state health department as, you know, the program manager to women's health, having done countless research articles, presentations, mentoring other students on women's health. And here I am living now the work that I did as a woman with cancer. And so it came full circle, and I realized that this was an opportunity for me to realign my purpose, to take something that could be very devastating and use it as an opportunity to help make change. And one of the things that I can say, living through the patient experience, is that there's a lot of very, very gifted, talented healthcare providers out there. There are a lot of very good facilities. But with that being said, there's a lot of burnout. There's a lot of area for opportunity, and I'm experiencing that. And I'll be honest, I am now on my 3rd oncologist because I was not happy with the care that I was receiving or the experience that I was going through. And so I realized that this is a wake-up call, that I have been given an extraordinary gift, and the, you know, discipline in which I earned my degrees, to be able to be an academician, to work with hundreds upon hundreds of students that I can mentor and befriend through the process and encourage them to go out there and help be a catalyst for change within the healthcare system. We can go to the next slide, Lita. So another thing that this has allowed me to do is to build relationships. And so when you research what a relationship is, it's often in the literature referred to as a close connection between people formed by emotional bonds and interactions. These bonds often grow from and are strengthened by mutual experiences. We all know that our relationships are not static. We are continually evolving, and that in order to fully enjoy and benefit from those relationships that we have, we need skills, information, inspiration, practice, and social support. You know, if you look over the spectrum of just the last decade, not your full lifespan, but just the last decade, you'll notice that the relationships that you've had with people have changed. Some started off as very superficial and have evolved into a deep connection. Others that you believe to have had a deep connection with may no longer be an established relationship, or maybe a very intermittent type of relationship. And so, you know, as we grow through our lifespan, we achieve more experiences, we evolve in our relationships and our social support. For me, cancer allowed me, as far as relationships go, to create compassion in the course room and with the students. This compassion for me was the willingness to be open about my journey, to be vulnerable with others, and even in my painful times, to be gentle and non-judgmental. I think that when you feel a compassionate empathy toward other people, that it opens up the lines for better communication and a stronger bond. And so, you know, I've had students ask me very serious questions regarding, especially because our students do come from a healthcare background. You know, I even have medical doctors, I have nurse practitioners, health researchers in my courses, and they do ask those hard questions sometimes about, you know, my 5-year survival rate, what my lifespan is predicted to be, what stage the cancer is in. And part of me wants to shy away from that. But I said, when I decided to share this, that I was going to be authentic and transparent, because by doing so, I'm able to create relationships. And so I do answer those questions. And I have found that, you know, the students have been very supportive and very kind and encouraging, and it's created a rapport with the students that I've had the privilege of teaching since my diagnosis in August. And that the line of communication seems to be much better. How I perceive their communication, how I'm able to put the things I want to say out there. And I have, as I said, I've been doing this for 15 years. And I have never felt a stronger bond to the students and the community in which we belong than I have over the last 8 months. Going on to our next slide. So security. We all definitely want to feel safe and secure in the environments and the communities in which we belong. I think that the last 3 years of the pandemic has definitely demonstrated that. And so, again, when you go to the literature and you start researching, well, what is security? The key takeaway is that security means taking steps to keep yourself and those around you safe, learning to deal with threats and anxiety, and having healthy relationships with others. So I'm a mother, and I am fiercely protective of my children, and ensuring that their security is at the forefront of everything that we do. Sending them to school, making sure that the school is safe and secure, making sure they're safe and secure in the car, riding their bikes, you know, everything is about their safety and security. And so I feel that by being a mother, I have a little bit more of an inclination to want to protect others, not just my children, but others. And so by protecting others and then creating a safe and secure environment means building a foundation of trust, using empathy to learn how and when you can help, and taking steps to care for your community. And most of all, creating an equitable, inclusive, safe space for all. I know that over the last couple of years, this has been a major topic in the work that we've been doing here at Walden, is creating an inclusive space, a safe space, making sure that everyone feels equitable and included. And for me, I think that having gone through the last 8 months with my journey, what it has taught me is that while I have equal access to resources for safe and effective care, many people do not. And so by navigating my landscape, I've been given an opportunity to assist my students with not only using their healthcare degrees to create a change for a more equitable society to increase security and well-being, but I also feel that now I have a responsibility to ensure our students have access to resources to ensure their own security. And, it could be anything from helping them make an appointment with the writing center to, something truly challenging is happening in their lives and working together to find help. I recently had a student who shared with me that she's pregnant with her third baby and that they've experienced loss and that, this pregnancy is challenging and very scary, having experienced a pregnancy loss prior, and then it's also higher risk. And then she felt very out of sorts and didn't know where to go. I was able to work with her in finding some really, really good resources to bring to her doctor's appointments, to ask very specific questions to know the situation before her. I found her some resources for meditation, for expecting mothers, and, also just hold her. If there's a day you're not feeling well or that you're overwhelmed, reach out and I'll work with you on extending the deadline for an assignment or a discussion. And that, she's not alone going through that. But I think that she needed to feel that she was secure, not only within her course room, but secure within establishing her care and within her mental health space. And that we are given a great opportunity to do that because I want to feel safe. I want to feel safe in my home, in my community, where I am part of, a greater landscape. And this diagnosis has definitely taught me how I want to be treated. And so now I get the great opportunity to build the scaffolding to treat others. Moving on to the next slide. So community of care. Before I start sharing what I believe a community of care is, I would love to hear from some of you what your definition or best practice of community care is.
And once again, you can raise your hand or type it in the chat.
And some of you may still be working on what you define as a community of care. Anybody want to share? No. I see Sarah has her hand raised.
Well, first of all, thank you, Heather, for sharing. Many have expressed you've done a great job, and I appreciate. I'm so happy that you're on our team. So I'm excited. I think community care is difficult to define because it's really defined by the giver and it's defined by the receiver, and those two may or may not match, and they may change. As you stated, your student, 6 weeks ago or 6 months ago, her definition of what a caring faculty member looks like probably would have been radically different than it is today. And it is, so I think those are evolving definitions, probably impacted by the environment that we sit in and our current and our past and our potential future experiences. And so I think one of the things that I try to do is not be judgmental in that and have an expectation what I think is a community of care or project what I feel is a community of care, but rather ask a student, as as an example, ask a student and say, what would you like to resolve this issue at this point in time? What could you see as, quote unquote, not using these words, but a community of care? How do you feel? What do you need at this point? Not project what I feel or what my past experiences have created for that other person. So I think it's listening and asking and being willing to maybe have a different definition than what we think.
Definitely. That two-way communication, I think, is an essential tool for building that community of care. Thank you, Sarah, for sharing that. I see Gloria typed listening to students with intent. Does anyone else have a thought about that or an idea of what community of care might mean? Well, I will share what I have felt or learned about Albert. Let me see. Albert shared he believes that a community of care listens and hears what the other member of the community says. It is empathetic, it's open, and it's non-judgmental. It's a beautiful statement, Albert. Thank you for sharing that. When I started researching the concept of community of care, it was a new notion to me when this came on the scene a couple of years ago. And I thought, oh, I care, I'm here. But as I've gone through, as everyone has, the last couple of years of the pandemic, I've watched my children, start to grow. They're in school, experiencing my own diagnosis and interacting with my students on a more personal note and level. My belief of what the community of care looks like has been evolving, as Sarah said. It's going to look different for every person that's part of the community. It's going to look different for me based upon the situation at hand. But in order to build the foundation of the community of care, I have found that the community of care must acknowledge our own vulnerability, challenges, and strengths. Everybody's going to bring something different to the community. And that's great because it will provide us a wonderful platform to, embed ourselves and to be part of this community. It's recognizing and honoring everyone's unique life experiences. I have students that are international students. They come from all over the globe. And I love listening to their cultural heritage, hearing about their country, how things are different there, how, protocols for bedside clinical care is different in Ghana versus how it is here in the United States. And that trajectory of those experiences, how their trajectory led them here, how my trajectory led me here, and how now we're both in this same community. A commitment to listening to learn. And so, there's a difference between I hear you and I'm listening to you. And that's one of the things that I have had to very deliberately work on is listening, not just reading an email, taking a phone call, providing a reaction or response to the words on the page or the conversation that occurred, but really leaning in to listen. And by listening, I'm able to learn about situations. I'm able to learn about people. I'm able to learn about needs. And then I'm able to learn what I can do in response to be committed to providing that community of care. Another tool to lay the foundation is replacing blame with curiosity. Instead of saying, sorry, you've been late for the last 3 weeks on all your assignments, I'm not grading anymore. I replace the response with, thank you so much for taking the time to submit these assignments. I appreciate your diligence on this, although I know they are late. I've noticed that they've been late for the last 3 weeks. Can you share with me, are you willing to share with me not only what's going on, but ways in which I can help you? And so by opening the dialogue, showing them that I'm curious as to how I can help them, how we can provide an opportunity for them to be successful in the course, I think has gone much further in the facilitation and the culture of the course room than just saying, nope, you're late, sorry. Also providing opportunities for open dialogue and respect by sharing different and differing perspectives. Really, our students come to us with a rich and robust experience. And I think that it is those experiences that make Walden so unique as a higher institution of learning. And so by recognizing those experiences, I'm also able to understand that all our students are going to come to us with different perspectives. And when you create a community of care that's respectful, we can openly share those perspectives, and we can understand more about one another, and then also create an opportunity to think and to potentially create change, social change agents, if you will. Also encouraging experimenting with new ideas and processes while creating a sense of security, and then practicing authentic acts of compassion, gratitude, appreciation, and recognition. Albert, I believe, yes, and John both typed in the chat. John said that he thinks that a community of care is a support group that is truly interested and concerned with the person, including looking out for and on behalf of the needs of the person and providing the needed care of the person if so qualified. Absolutely. Albert shared it's important to listen. It is equally important the other person believes you heard what they said. 100%. Listening and communication is a two-way event. And so it's not just enough for me to say I'm listening. The other individual in which I'm receiving the message from has that opportunity to confirm and affirm that I've not only listened, but I'm going to engage and act upon what I learned. And, a support group, definitely. I said this in the very beginning of this presentation, that I am very fortunate to be part of the Walden family and community, to be on the team in which I am, because I have a support group through this process. And I hope that through the course rooms, through residency, through graduation, that we can continue to build a support group and a community of care for our scholars, and then our graduates and our alumni, and that people understand Walden isn't just a degree granting institution. It's a place of care. It's a place of social change. It's a place of safety. And because I can tell you, I have worked for institutions where if I was going through this I couldn't do it. And so I'm very grateful that I have the honor to work here and hopefully provide the same care and support group for our students. So going on to the next slide, here are some resources if you are curious about relationship building, creating a community of care and inclusive teaching in your course room. These are some of the seminal pieces that you'll find in the evidence-based practice. And with that being said, before we open the floor for questions, I just want to thank everyone for not only being here today and listening and participating in this dialogue, but also to all of you who are part of the Walden community for being a true support system to me during all of this. My diagnosis, unfortunately, has likely shortened the number of years that I will have to build and leave a legacy as a researcher, a mentor, and a teacher. But the one thing I've learned is that it's given me a very powerful tool to connect and show my students why the material they're learning as healthcare administrators and managers matters. I will say that it hasn't been easy to be vulnerable with all of you and with the students, but I do believe my personal story is one of the most important lessons that I'll be able to teach our students. So with that being said, are there any questions, comments, anything of the sort?
I have gone ahead and made everybody's mic active. So if anyone just wants to chime in, I know there's been some fantastic comments in the chat as well. Lots of thank yous, Sarah, Heather, thank you. Wonderful job. Jennifer Miller as well, sending her thanks.
This is Miriam. I just wanted to thank you again for your willingness to share and set an example for us, because we may listen to our students and, you know, create great relationships with them, but you've provided an example of how it's often more two-way than perhaps we've seen it before. So I just wanted to thank you for sharing.
Thank you, Miriam, and thank you for everything you've done for me since I came to the Walden family 3 years ago. I
Well,
see John. Oh, John, you're always a wealth of information.
oh, that's wonderful. Well, I want to thank you on behalf of the Office of Teaching and Learning Excellence for sharing your story today. Dr. Alonge, and I'm finally saying it right, I think. But thank you so much for being vulnerable. I know that takes a lot of courage, and sharing your story, and also ways that you've implemented, you know, what is, you know, a situation that's, you know, a sad one, heavy on your heart, and turned it into something positive when working with your students. So really appreciate that. If anyone missed any of today's session or wants to refer this session to somebody, this session will be placed into Commons and will be available by the end of the week. If you have any questions, please reach out to us at otle@mail.waldenu.edu. And we hope to see you again in one of our upcoming sessions. And thank you again, Heather. It's been wonderful listening today.
Thank you, everyone. Have a wonderful afternoon.
Thank you. Bye-bye.
Bye-bye.